All right. Hello, everyone, and welcome to Engaging Non-English Speaking Patients, How to Promote Health Equity Among the LEP Population. I'm Ryan, part of the AHHC team, and our speakers today are Michael Pepe, Director of Solutions Engineering for Cinzy, and Gerard Barsoum, Director of National Accounts for AMN Language Services. I want to remind you that you may post comments in the chat feature or questions in the Q&A feature, which are located on the right side of your screen or in the details section of this session in your mobile app. And at this time, I'll turn it over to Michael and Gerard.
Thanks so much, Ryan. Appreciate it. So I'll just briefly discuss the agenda as you can see on the screen. We're just going to go over quick introductions about ourselves, AMN Language Services, and Cinzy, so you get to know a little bit about us and where we work. Then we're going to discuss a little bit about ensuring meaningful access for patients with limited English proficiency, or as you'll see in the presentation, we'll use the acronym LEP for limited English proficiency. And then we'll discuss overcoming language-based inequity in healthcare and using telehealth to better engage your LEP patients, and finally, how to communicate with the most vulnerable patients during the pandemic. Michael, go ahead.
Yeah, thank you, Gerard. And excited to be here this afternoon. Good afternoon, everyone. My name is Michael Pepe. I'm the Director of Solutions Engineering with Cinzy. And Cinzy is a virtual care company based in St. Petersburg, Florida, focused in healthcare and focused mainly solely on post-acute and home health, and achieving a comprehensive communications platform for patients, family members, staff members, all being able to communicate securely over our platform. So thank you, Gerard. I'll turn it back over to you and go into virtual care shortly.
All right, perfect. Thank you, sir. And my name is Gerard Barsoum. I'm the Director of National Accounts at AMN Language Services. We were formerly known as Stratus Video. Some of you may know our formerly known name, Stratus Video, and we were acquired by AMN Healthcare early on last year. We provide interpreter services and translation services, mostly for healthcare clients. We provide video interpreting, over-the-phone interpreting, translation services, and interoperability with telehealth platforms as well. So we're first going to go ahead and discuss what meaningful access is. I know that's a buzzword that most people have heard. Maybe some of you know what it means, some of you don't necessarily know. I like to really think of it as just the definition as the words themselves, providing access to your patients, providing access to your patients, providing healthcare access to your patients in a meaningful way that actually makes sense to them. The Joint Commission explains it as, a really effective communication that allows the patients to participate more fully in their care. Obviously, the more they understand their healthcare, the more informed they are, the better decisions they can make, and the better outcomes for them, and of course for the healthcare providers as well. So for LEP patient population, for them to have meaningful access, we always need to make sure that we provide them with the language services that are really required by law, and that could be anything from on-site interpreting to video remote interpreting, or VRI for short, OPI, which is over-the-phone interpreting, on-site interpreting I already mentioned, and of course translation services. Translation is really usually for written documents and mostly used for vital documents and discharge documents. So rules and regulations, there's quite a bit of them. All of the Title VI of the Civil Rights Act, National Class Standards, ADA, Americans with Disabilities Act, the ACA, the Affordable Care Act, and even the North Carolina Department of Health and Human Services all require for any healthcare institution to provide interpreter services or language services to any patient who prefers to discuss their healthcare in a language other than English. And I really emphasize that because pretty often we might see a patient that we think speaks English and speaks English well, but often enough, they may prefer to discuss their healthcare in a language other than English because they're a lot more comfortable with it. So that's why I really wanted to emphasize that. Moving on, Mike. And there's been quite a bit of studies that have shown why effective communication is really truly essential for positive health outcomes for LEP population as well as your deaf and hard of hearing population. So as you'll see in this slide, the LEP population are significantly more complex with higher tendencies of comorbidities. Hospital stays are significantly longer for LEP patients that are not provided interpreters. And even the readmission rates for any patient that is not provided interpreting at every point of care is significantly higher than it is for English-speaking patients. And that last chart at the bottom even shows you how the adverse events are significantly higher for LEP patients than they are for English-speaking patients. So I really want to emphasize that, whenever possible, provide those language services. Whenever required, please do provide those language services to those patients. So some guidelines to improving meaningful access. There was a pilot study done with Joint Commission accredited hospitals that showed that there was really three main things that we could do that can make a pretty large impact on how to improve meaningful access. One of those, the first things is really pretty obvious, identifying the top languages needed. It's really helpful to know the top languages needed within your area of care in North Carolina, for example. And to be able to collect that language data at the patient point of entry during registration or any other point of entry, you really want to be able to gather that data and find out what that language is that they prefer to discuss their healthcare in. Some of you may wonder, how can I do that if I don't speak that language? Good question. I'm glad you asked. So the Department of Homeland Security, believe it or not, has an Office for Civil Rights and Civil Liberties, and they provide what we call in the industry an I Speak poster. And it's literally just a poster that you can print out yourself. If you even Google I Speak DHS, you can pop it up real quickly. And it's just a simple poster that literally just says, I speak Armenian, I speak Arabic, I speak French in said language. And it's basically something that you can point to your patients and they can just point it right out to you. Say, I speak that language, and then you can see the corresponding language, obviously in English, so you understand which language they speak. So that's really a good way for you to collect that language data up front. If you don't have access to an I Speak poster for some reason or another, but you do have vendors that you work with for language services needs, whether it's over the phone interpreting or video interpreting, our interpreters or operators with pretty much every single vendor that provides the services can also assist you with this as well. They'll ask you qualifying questions about the patient so they can really try to help you recognize what language they speak. So they might ask you the patient's name or maybe the color of their skin. They might ask you to point out ask the patient to point out their country on a map. And as long as you're patient with them, they'll usually be able to get you to the right language eventually. Sometimes it might take a couple tries for them to figure it out. They might connect you with one language interpreter, and that interpreter might say, oh, this actually sounds more like Cantonese. You might want to transfer them to a Cantonese interpreter. So the language services providers, the vendors, should definitely be able to assist you with that as well. And lastly, you really want to be able to document that the language services were provided in each session, in each encounter. Every single time you use an interpreter, you always want to document telephone interpreter ID number 12345 was used, or video interpreter, or in person. Just document that in the medical record. So who are the LEP patients? LEP patients, we have a good amount of LEP population in the US. These are some stats right on the screen. I'll go over some of them. There are currently more than 25 million LEP individuals in the US, 350 languages spoken in US homes. This is nearly 9% of people in the US are considered LEP, which is a pretty high number. And even when I read that, I was actually pretty surprised by it. I guess I shouldn't be because, we are a melting pot, but it's a significant number there. 1 million LEP home health patients today need language access, and roughly 11 million in the US are deaf or hard of hearing, which, by the way, is the correct term for our deaf or hard of hearing friends. They are not hearing impaired. They prefer to be called deaf or hard of hearing. And finally, we see a higher percentage of LEP patients report having low health literacy levels than English-speaking patients. I know that we've all been to nursing school or med school, and we always learn about speaking at the right health literacy level. I believe it's the 5th grade health literacy level. That's usually the same thing you want to do with your LEP patients. Make sure you're bringing it down to the right health literacy level Instead of calling it a myocardial infarction, just call it what it is. It's a heart attack. Keep things simple for your patients as well as your interpreters too. And in North Carolina, I'm sure this is pretty obvious to many of you. We have at least 42% are foreign born. Top languages include Spanish, Chinese, Vietnamese, Korean, French, and Arabic in that order, and followed by Hmong, Russian, Tagalog, Gujarati, Khmer, which is the correct pronunciation for that, by the way, Khmer or Cambodian language, German, Hindi, and Laotian. And across the 4 metro areas, the U.S. Census data shows us that Vietnamese is the top language in Charlotte and Greensboro, and Chinese is the top language in Durham and Raleigh. So whenever you're in those areas, definitely be prepared to provide those language interpreters. Sorry, Michael, go ahead. And why use qualified interpreters? This is pretty basic stuff, but I'm going to go over some of it. I did want to point out common misconceptions, because there are often misconceptions when it comes to interpreting that we just think we understand it, but we don't necessarily know. Common misconceptions: anyone who's bilingual can interpret. This is a big one. I'll just give you one example, personal example. I'm trilingual. I speak Armenian, French, and obviously a little bit of English. And I'm working on Spanish too, but for the longest time, I believed that I was fluent in Armenian and French. When I was in college, I had a fellow peer of mine that was working for a hospice agency and said, "Hey, we have an Armenian-speaking patient. We can't find any interpreter. Would you mind interpreting?" I said, "Yeah, sure, no problem. I can do that." I went on site and tried to interpret for this patient, and there's huge emphasis on the word "tried." I did not do that well. This regular 10 or 15-minute conversation ended up taking me about an hour and 15 minutes to come across, because there was so much vocabulary, medical terminology that I thought I would know that I really did not know. So I spent half the time opening up a dictionary to try to interpret everything accurately, because I did want to at least do everything accurately. But it really was a disservice for the patient, unfortunately, and a disservice for the healthcare providers as well. So anyone who's bilingual cannot necessarily interpret, and we'll go into that a little bit more in the following slides. Next misconception is that family members make good interpreters. I see this pretty often. Part of my previous role at Stratus or AMN Language Services was to go on site, deploy our services, and train staff. And more often than not, I'd hear staff say, "Oh, I don't need to use that." They usually bring their family members and they just interpret for them. Try not to do that. It really should be used as a very last resort when you've tried getting an on-site interpreter unsuccessfully, tried getting a video interpreter unsuccessfully, telephone interpreter unsuccessfully, and then as a last resort, because you had no other option, you had to use a family member. That should be really, truly the only time you use family members. Just so many reasons why. I discussed how, just because they're bilingual doesn't mean that they're necessarily an interpreter. Interpreters have such a wide array of skill set that most bilingual people don't. They also learn medical terminology that most people wouldn't necessarily be familiar with. Minors there's many studies that show that minors can actually even be psychologically harmed and damaged by having to interpret for their parents or grandparents or siblings, because it's just too much stress on them, and having to interpret the bad news or the not so great news can be very difficult. And often enough, you'll even see patient family members that don't want to interpret accurately. They don't want to tell their grandfather they only have a week to live. "Oh, you're fine. You're going to be okay. The doctor said you're doing great." It's very dangerous to use family members. I really do want to urge you, if there's one thing you remember today, is just please avoid it at all costs. Even if the patient tells you, "No, I want to use my interpreter," I want to remind you something that you may not be aware of. Even if the patient wants to use their family member as an interpreter, you yourself have a right to an interpreter. So you always have the right to say, "I respect your decision to want to use your family member. I want to pull up an interpreter because I have the right to an interpreter myself." And then you can pull up an interpreter, explain the situation to them, have them listen to the conversation, and tell them, "Please interrupt us if anything is misinterpreted." And more often than not, if this is the case, they will cause so many interruptions that the family member will eventually say, "You know what, let's just let the interpreter do their job." So that's really a good way to get around that if patients or family members really insist on interpreting themselves. Go ahead, Michael. And then medically qualified interpreter training. So all of our interpreters at AMN Language Services are medically qualified interpreters. All interpreters rather do have interpreter training that they go through that really helps them with short-term memory and note-taking. If any of you all have ever worked with an in-person interpreter, you'll notice that they usually have a piece of paper like this with notes and symbols and all types of stuff, really helping them retain everything that's being said. And they do this because that's what they learned. And for you, it looks like chicken scratch, but for them, it's really helping them retain everything that's being said. Interpreters also are trained on modes of interpretation. What do I mean by that? There's two modes of interpretation. There's simultaneous and consecutive. They are exactly as the words, as the meanings are. One is simultaneous. So as you're speaking, they are also at the same time interpreting the same exact thing that they're hearing you say. That's simultaneous interpreting, usually not used during telephone or video interpreting because it's pretty difficult unless you have the really good high-end speaker phones that are full duplex that can really accommodate with two people speaking at the same time. Otherwise, it doesn't really work. And then, of course, what we see more often than not is the consecutive interpreting. They also learn about the rules of the medical interpreter, what they can and can't do, what they should and shouldn't do, protocols and session management. That's very important too. They'll help you right off the bat, introduce themselves and tell you what to expect during this encounter. They'll explain it to the patient and also to the healthcare provider about what to expect. And they'll even, take the role of taking a step back and stop the conversation or slow things down if they deem that something is being misunderstood by the patient or by the healthcare provider. They're also using medically qualified interpreters also really helps with cultural awareness and responsiveness. I have one really good example. This one, I'm trying not to give too many stories, but there's some good examples after doing this for so many years. One of my clients in Lowell, Massachusetts, if any of you all are familiar with that area, there's a very high Cambodian population. I was on site doing my regular thing, building stands and deploying them out and training. And I actually had one of the on-site interpreters helping me out while I was on site. This was 4 or 5 years ago. And they shared a story with me that stuck with me to this day, obviously, since I'm sharing it with you, where they were doing interpreting for one of the Cambodian patients who came in just for a regular checkup, but they wanted to see their PCP because they were having constant headaches. And the provider was asking questions, and the interpreter noticed that the questions started going in one direction, where they're asking, are you okay? Do you feel safe at home? Is your husband abusive? And all of a sudden, the interpreter put 2 and 2 together and figured out what's going on. So the provider was looking at this patient and seeing bruises and marks all over their body, and was like, what's going on? I can't understand how a headache is related to this. Maybe and they wanted to get to the bottom of it. And the interpreter had to take their second role, which is as a cultural broker, and basically tell the provider, hey, I think I know what's going on here. If you'd allow me, I can ask the patient for clarification. In Cambodia, some Cambodians, especially the older generation, they believe that rubbing the skin until it burns or bruises can relieve pain. So I think that's what's going on here. And all of a sudden, the provider's eyes opened wide up and was like, yeah, please ask. And sure enough, that's exactly what was happening. So it's unbelievable how there's a lot of this cultural awareness stuff that we may not be aware of as Americans, but by using interpreters that are coming from that culture can really help us out with. And finally, as I mentioned earlier, there's a lot of language-specific vocabulary and medical terminology that most of us wouldn't necessarily know unless we've been to med school in that specific language or nursing school in that specific country, rather. So there's a lot of that as well. And finally, some more advantages to using trained medical interpreters. First off, fewer visits to emergency departments, shorter hospital stays. We saw the chart earlier showcasing that. Lower costs due to proper evaluation and testing, faster diagnoses, compliance with care plans, Actually, I'll take a step back too. And with inpatients, we always see a reduction in readmission rates, which, as we all know, also helps with reimbursement rates as well. And then better understanding of your medication instructions. One more story for you. Medication instructions, this is another known story within the interpreting industry. Something as simple as writing medication instructions to your patient. Please take ibuprofen once a day. Once a day, spelled O-N-C-E. In Spanish, O-N-C-E is once, which is the number 11. So there has been experiences and times where people have thought they were supposed to take something 11 times a day, and it has caused adverse events and even death at a few different instances. So something as simple as that, where we wouldn't even think twice about, all of a sudden really does pop out when just with one word like that has two different meanings depending on the language. And again, last but not least, just higher satisfaction scores for the patient. So it really is a win. You have faster diagnoses. You're going to spend less time with your patient. They're going to be more satisfied, and your institution is probably going to be reimbursed even more than they normally would if you use an interpreter. So it's a great win for using medically qualified interpreters.
Perfect. Thank you, Gerard. How does everything tie in that Gerard just mentioned with telehealth? And they go hand in hand. So really just to walk through some of the benefits of virtual care and telehealth and how they tie into assisting the LEP patient. Now, some of these things that you see on the screen, benefit all patients. But really the key ones that stand out, and really just from Gerard's last slide, of what a lot of folks use our platform for. And if you're using a virtual care or telehealth platform without interpretation built in or without translation services, you're missing a huge benefit of these platforms. And like Gerard mentioned, to be able to do medication reconciliation is a big use case and a big benefit of a lot of our clients. And if they, post discharge, maybe it's day 2, patients at home, you're sending out a message in the patient's native language if they have any questions on their medication, whether it's a text or an email, and then they're launched into a virtual visit with their clinician, and then the clinician maybe might need to bring in a video interpreter. Being able to do that medication reconciliation in real time over a video visit, has been a huge prevention in injury and just in patient satisfaction in general. So just kind of tying back to Gerard's slide of improving the quality of care, increasing productiveness, minimizing ER visits, because the patient understands what they need to do for their plan of care. They understand all their instructions. A lot of patients that maybe English is not their first spoken language. I forget the statistic exactly, but I believe it's only 20 or 23% are actually reading those messages. So if you're able to have a platform that conveys those messages in their native language, and to do a virtual visit on top of that, it is a big one. And so obviously the number one benefit for telehealth that we see with our clients, reducing drive time, having to drive all over the state, or just putting eyes on a patient immediately, and then being able to bring in that video interpreter on demand. So some of the use cases for our clients, just some of the different ways they use the platform. And this all ties into either a translated message. So whether it's a welcome message, as you see there on the top left, if you have any issues, if you're experiencing any of these symptoms, here's the phone number to call in the patient's native language. A big one that we see is wound care as well. As well as just managing different chronic conditions like CHF, COPD, diabetes. So having those messages already pre-translated, if you're working with a population, let's just say a Spanish-speaking population, if you have all those automated type of programs where the patient's getting education in their native language, we've seen a huge uptick in the benefit for that. Another major one down there on the bottom right is emergency preparedness. So we have the ability within Cinzy to mass blast a message out to patients and their family members. I'm in Florida. I know you all being in North Carolina, very similar type of hurricane season weather. So being able to blast out it's hurricane season, remember to stock up on your medication, or if you run into any issues, here's the phone number. So if you're able to do that message in English plus in a patient's native language is a huge benefit. Okay, so really just some of the benefits of language interpretation for telehealth, and this kind of just ties in a little bit, but the big thing for having an interpreter, there's less non-compliant patients, right? So the amount of prescriptions filled when there's an interpreter provided, the amount of action taken by a patient when there's an interpreter present, as you can see on the graph, is usually double or quadruple. So we found that a lot in a lot of our patient engagement reports. We have a whole back-end reporting system where we can tell patients are opening messages. Maybe they're in a post-hospital discharge type of program or a CHF program where they are getting medication reminders. They do need to do virtual visits, and you are monitoring those high acuity patients more closely because they might be at a high risk to readmit. And when there is an interpreter provided, we've kind of gathered this data of there's a lot more actionable items that have been completed by the patient. So just mention some of these. The big thing of how telehealth supports the LEP patient, really twofold: the live video interpreter and the virtual visits, and then the translated messaging. So, not just the video visits, but like I mentioned, if you're doing some sort of automated patient education campaign that goes out by text or email, or maybe in application, having those messages translated has led to a higher compliance as well. So just to show you all a little bit what our integration looks like directly within Cinzy for a live video interpreter with AMN. And Cinzy now is actually a part of the AMN family as well. Us and Stratus Video previously had a pretty long-standing relationship. So we have a pretty deep integration with their live video interpreters within our platform. And you're seeing two of me on the screen right there, but imagine that is the clinician speaking with the patient over a virtual visit. That provider can realize the patient is an LEP patient, and they can simply bring in a live video interpreter directly while they're on their mobile device or on their computer having a conversation. So if you see there from that plus sign, it brings up another screen where they can add a staff member, they can add a family member if they need to, but on that second screenshot, in the third tile on the bottom, you see the interpreter tile. And directly from there, they can select the language of that specific patient, and a live video interpreter will come directly into the call. So this is just some examples of more on the translated message side of how our clients are using the platform with language translation within there. Like I mentioned, big thing is welcome message, but another big thing is appointment reminders. So we have a lot of clients use our platform to reduce no-show appointments. If you're showing up at a patient's house next week or this week and maybe they weren't home, maybe they did receive the message, but it was in English and they, did not know when, what specific day it was. So being able to gauge those types of things as well. Some other ones are, tuck-ins or just dietary reminders. On the therapy side, exercise reminders. And then these kind of go through, really any condition that you can configure within our platform. And then, of course, the last one is a weather type of alert, as you see here, winter season, or like I mentioned, hurricane season as well in the patient's native language. So just a quick little screenshot of on our platform of what it would look like in the application. We do have a patient-facing and a family member-facing application. If you see the first screenshot, this is just a medication reminder in English, and then the following, I believe that's in Russian, and then in Spanish as well too. So it could simply be chosen from a drop-down. I want to go ahead and send this campaign, these pre-scheduled messages in Russian, in Cantonese, and Spanish, whichever languages you are servicing, and then those messages automatically go out to the patients. So just some feedback that we received from patients over time. Really, the big thing was, they felt like they were, being listened to. They felt like they were able to understand the visit. They were able to understand what their plan of care was coming up. You see the second quote there. We work with Accent Care as well too, across the nation. Primarily started with them in wound care as well. So being able to, if a wound care nurse needed to provide some instructions on how to change a bandage, how often you should change it. If that patient was a Spanish-speaking patient, being able to bring in the interpreter so they can clearly understand the instructions, and give them that peace of mind while they're taking care of their wound. So thank you, Gerard. Back to you.
All right, perfect. Thank you, Michael. So next, we're going to discuss how agencies can better engage LEP patients among the public health emergency. So we, before this presentation, I did reach out to my language operations team just to ask them for some of their insights on what they would tell an audience like you if they had the opportunity to give you some insight. First off, of course, we always want to say use qualified and certified interpreters, always certified whenever possible. There's only, I think, 7 languages that actually provide full certification, and otherwise you should just make sure to use qualified, medically qualified interpreters. And accept interpreter as part of the team. That's such a big one. I think it really makes a big difference even with the patients when they find that you as a healthcare provider are making sure that this interpreter is deemed as part of your team and you're working with the interpreter. They'll tend to respect the interpreter a lot more, listen to the interpreter a lot more, and also accept them as their interpreter to help in these conversations that they're having with you as a healthcare provider. Use interpreters. So one of the reasons you really want to always use qualified interpreters is because they've gone through a lot of schooling and they have a code of ethics that they have to abide by. And it's standards of practice and code of ethics are super important when it comes to interpreting. Just because you want to make sure they're interpreting everything accurately. You want to make sure that they're not repeating anything. Everything is being held confidential. So it's really important that you make sure that they're all qualified. Be aware of your own cultural biases. We all have them, and it really helps to sometimes just take a step back and acknowledge it and say, I'm not really sure what's going on with this patient interpreter. Do you have any idea? Or, maybe I should be asking the right questions to the patient because I'm not understanding fully what's going on in this encounter, in this situation with this patient. So be aware of that, accept it, and acknowledge it, and then try to gear your conversation towards that, knowing that you're not going to necessarily understand everything that's happening in everybody's culture. And then finally, understanding that a linguistic barrier does not mean unintelligent. One personal feedback, I see this often, is when people are working with interpreters or working with patients that don't speak English, is you'll see staff speaking louder. Can you hear me? Hi, I'm your nurse. You don't need to do it. If you want to test the quality of the microphone, you can always ask the interpreter, hey, I'm speaking at this level. Is this a comfortable level? Can you hear me comfortably, or do I need to speak louder? You can do something as simple as that. Because even speaking louder, the patient right off the bat is going to be like, okay, what's happening here? Or, why are they speaking so loud and in that manner? Even if they don't understand the words that are coming out of your mouth, they're going to understand what your mindset might be by speaking so loudly and in a slow fashion. Some more insight we got from the field was that, especially in a time like this, where in our current pandemic, but really in any time you're dealing with patients, that there's always demanding situations, especially a lot for these LEP patients. We saw the charts earlier about some of their comorbidities and whatnot that they may be dealing with. Just realize that there's always physical demands for these patients. Just be aware of that. Misunderstandings can be had, and patient errors are really due to lack of communication was huge. So common errors when working with non-qualified interpreters. By the way, there was an article in PubMed.gov that went over some of the common errors that can be seen when not working with medically qualified interpreters. 52% of the errors were omissions. Imagine you're giving instructions and half your instructions are being omitted. It can have a huge cause and effect with your patient's overall health outcomes. False fluency was 16%. Case in point, this guy, when I tried to interpret when I was in college, substitutions, substituting one word for another, it can really change the whole entire course of the conversation and understanding of what's being said by the healthcare provider. Editorialization, i.e., I heard you say this, doctor, but I'm going to say it to them a different way. Medically qualified interpreters know not to do that. They're going to interpret everything you say in the manner that you say it in, if it's possible, of course, in that language. Some different languages, it's not always easy to do that, but they're a lot less often to do that. And additions, 8% additions. So people that are non-qualified interpreting, adding things to what you're actually saying to them, to the patient. So you really want to make sure that that doesn't really happen. And then I think it was 63% of all errors had potential clinical consequences, with an average of 19 errors per encounter, per conversation with your patient. So I think those numbers really speak for themselves as to why you want to use qualified interpreters. Moving on, some more insight we got was show trust in the interpreter and interpretation delivery methods. What I mean by interpretation delivery methods is it could be in person and over the phone, via video, or via telehealth. Show trust. The more you show trust in it, the more the patient's going to show trust, and the more they'll be willing to open up and answer things honestly and comfortably. Using video and audio interpreters, whenever you do that, you are, in a sense, the eyes of these interpreters. So it's really important for you to actually give an introduction to the interpreter about what they're about to walk into. These telephone and video interpreters are literally sitting behind a screen like I am, and when the phone rings or when the video call rings, when they pick up, they have no idea what to expect. So if they don't get a proper introduction from you, the healthcare provider, it could really help. It could really be difficult for them to adjust about the conversation and what to expect. When I say proper introduction, it could be something as simple as, "Hi, Gerard. I'm Dr. Michael. I'm just seeing my patient who's here for his annual physical." It could be something as simple as that, or it can be something a little bit more, where you're saying, "Hi, Gerard. I'm Dr. Michael. My patient came in with let's say a headache or whatnot, but I also want to make you aware that they're hard of hearing, or they're soft-spoken, or anything along the lines of that, or they have early onset Alzheimer's." Those things will really help the interpreter adjust whatever they need to be able to help communicate with the patient as much as possible and the most successful manner possible. And the same thing goes with using telehealth. Our interpreters are now accustomed to working with Cinzy along with many other vendors where we provide interoperability with telehealth platforms. It's really important for you to also introduce the concept of telehealth to your patients, especially to your older population. It's really important to just introduce the concept and how it's going to work and what they should expect. After that initial introduction, I really want to emphasize that you should use first person when you're speaking to your patient. And I specifically said when you're speaking to your patient, because we often, and we all do this, it's not just one person or the other person, unless you've been working with interpreters for many years and have been sort of taught to do it correctly from the beginning. Many of us get into the habit of, "Hey, interpreter, can you ask the patient this?" Or, "Hey, interpreter, can you ask the patient that?" And that's not what you want to do. That really forces you to take your eye contact off of the patients and start looking at the interpreter, have a conversation with the interpreter. When you're working with interpreters, whether it's video, if it's video, you really want to point the video towards the patient so the patient can look at the interpreter and they can look at you easily without having to look left to right. And this also forces you to not look at the interpreter, and therefore also helps you speak in first person. Instead of asking interpreter, can you ask them? Just ask your questions. How are you feeling today? What brought you in today? That makes the conversation go by a lot faster, makes our interpreters' jobs easier, and really does help increase patient satisfaction as well. And then allowing the interpreter to provide insight about any situation that may be impacting the session is also very important. Interpreters are trained to really interpret anything and everything that is said, whether it's said from you, the person walking into the office, the brother that just walked into the room, if you're doing home health, whatever it is, they're going to interpret everything that's being said. That's especially true with your American Sign Language interpreters. So just quick caveat, be aware of that. If you ever say something like, oh, the patient's cute, they're going to interpret that more often than not. Be aware of that. But you're the main point is you really are the eyes of these interpreters. So you want to tell them, oh, by the way, my colleague just walked in. I just have a quick side conversation. They're asking me about another patient. Or the nurse walked in. They're going to be helping me with the examination. Something along the lines of that. So the patient, so the interpreter then understands, oh, why am I hearing another voice? Who is it? And then can also interpret accordingly. And then with technology, as we all know, we all have iPhones and computers. Technical difficulties are always possible. Just acknowledge that, and of course, work with your IT department to resolve any of those difficulties that you may have. But acknowledging it up front sometimes really helps if those difficulties do arise. And then finally, include the interpreter. Keep them informed. Let them know. Talk to them. Make them part of the team, as I mentioned earlier. It's so important, and it really will make a huge difference in the outcome for you and for your patients. And then some final tips and thoughts. I know I've gone over a lot of things, and you're probably sick of hearing me talk, but just a couple of final tips that I had. We talked about introducing yourself. You also want to, that when you're introducing yourself, if you think the patient's a little bit more complex, you really want to allow a little bit of time for what we call a pre-session with the interpreter. And this is really for your patients that might be a little bit more difficult for having communication challenges or whatever other challenges they may actually have. I mentioned earlier, speak directly to your patient. Speak at an even pace in relatively short segments. I'm from Boston. I'm awful at doing that. I speak so quickly and I'm all over the place, but you as a healthcare provider, try to do that as much as possible. Speak at an even pace, at a pretty decent pace like this I'm speaking at right now. And then short, I always try to tell people 1 or 2 sentences, stop, let the interpreter interpret. That's going to help you. That's going to help ensure that the interpreting is a lot more accurate, as opposed to you speaking for 5 minutes and saying, okay, interpreter, it's your turn, go ahead. And then if you're doing a question answer session, it's always great to just do one question at a time. Don't hold the interpreter responsible for anything the patient is not saying. If you think the patient's not saying something, ask the question. Just ask the question. The interpreter's not going to add anything unless they really feel that there is a cultural broker situation where they need to step in and make you aware of something. Avoid highly idiomatic speech whenever possible, complicated sentence structures, sentence fragments, things like that. Try to avoid those as much as possible. Encourage the interpreters to ask questions. That's also huge, especially for newer interpreters. If you encourage them to say, hey, interpreter, listen, if there's something I say that you're not understanding, please stop me and ask for clarification. I'll be more than happy to clarify. That puts everybody at ease and really helps ensure that the interpreting is happening in a proper manner and is as accurate as possible. And one of the couple last hints I always give is, if you're not sure the patient's understanding, or if you're not really trusting that the interpreter is interpreting everything, sometimes we have that gut feeling. Ask the patient to repeat it back. Can you repeat back the instructions that were just given to you? And then that's always a great way to find out and make sure that things were really accurately interpreted. And finally, just be patient. We all know it's not easy to work with interpreters. Sometimes it takes one encounter that should be 10 minutes, takes 20 minutes because things, in a sense, are being repeated, right, in English and then in the target language. So just be patient with the interpreter, with the patient, and I think you'll all be super happy with the outcomes if you really do the best you can to build that rapport with the patient and with the interpreter to ensure the best outcomes possible. So that's it for me, Michael.
Yeah, I guess, really just to add and to piggyback on, on Gerard's points, at least from a virtual care standpoint, hopefully now as the pandemic is waning down, it's virtual care is here to stay. There was a lot more exposure over the past year and a half to populations based on age, based on language that might not have used the telehealth platform or virtual care platform. So, a lot more folks are getting more comfortable with it than you might think. And, don't just look at a telehealth platform that has some bells and whistles. You want to really look for one that does have a pretty deep integration with a translation service or, live video interpreters, because, if you're missing that portion of a platform, you're not going to be able to effectively communicate with family members or patients on a virtual visit, or even just a normal text or email type of campaign, alerting them about things within your organization. So really important while you're vetting and looking at virtual care platforms, and not meant to replace in-person visits by any means, but if you're in person with a patient, and you might use your virtual care platform to just bring in the interpreter. You might not need to bring in someone else remotely over video. So really look for a flexible platform for that, and a platform that you can use within your organization that sets yourself apart from your competition and the services that you're able to offer. So appreciate everyone's time today. Thank you for having Gerard and myself today.
Thank you so much, everybody.
Great. And great job, guys. Great presentation. We actually do have one question in the chat here. It says, our system does not allow staff to use apps for translation, but in the home, I feel sure it happens. What are your thoughts and knowledge of the translation apps available?
Yeah, that's a great question. We get that pretty often in the field. None of them are up to par. None of them are up to par, especially when it comes to medical conversations. And that's why companies like us are still around, because even one word off can really change the whole entire conversation, and can really miscommunicate the meaning that you're trying to come across. They're used at home. I think they're okay to be used for something as simple as, where's the bathroom? I'm hungry. If patients at home or at an inpatient unit, I'm hungry, I need to go to the bathroom, I'm having some pain, but it should really end there. And a qualified interpreter should be used. Apps like Google Translation and all of them are just not up to par yet. And I think for any of you who have friends that are bilingual, ask them to test it out for you, and they'll attest to it as well. It's just, it's not there, especially once you have any type of medical conversation.
We've seen that as well in the home health setting. Google Translate does not take into account different dialects, or maybe different geographic locations of the specific language. And we've kind of compared what AMN, their interpreters have done in the exact medically certified type of translation versus a Google Translate, and it does not compare, and it won't resonate with your patients that do speak those languages natively.
Great. Well, we actually don't have any more questions. Is there anything else you guys want to say before we sign off?
I'm okay. Thank you, Ryan. Thank you for everyone's time today.
Yeah, I'm okay as well. Thanks, everybody. Really appreciate your time.
All right. Thank you. Yeah. Thank you, Michael and Gerard, for that wonderful presentation. And everyone, please don't forget to join us at 6 for the AHHC trivia by visiting your agenda and joining the live stream there. It's going to be a lot of fun. Thanks, everybody, and we'll see you tomorrow for the last day of the conference.